Good afternoon and welcome to the FEMA Region 2 Individual and Community Preparedness Webinar Series. My name is Allison Albright and I'm the Regional Preparedness Liaison for FEMA Region 2. I'm going to provide a few technical considerations before we begin. Today's proceedings are being recorded and captioned. The archived event will be available on the FEMA website. Use your audio through your computer speakers, so please ensure your speaker icon is green and your volume is turned up and we hear the proceedings accordingly. In the top right corner, we ask if you'd like to receive news and updates from Region 2. If so, please enter your email address and we'll be sure to add you to the distribution list. We will have a question and answer session after the presentation concludes. You'll see a Q&A pod in the lower right-hand corner. Please feel free to submit your questions about the subject matter there, and time permitting, we'll do our best to answer them. Finally, the PowerPoint presentation from today will be available for you to download in the file share pod as a PDF. You can click on the file and download it using the download button. With that, I'd like to turn it over to the Region 2 Community Preparedness Officer to introduce our speakers and today's proceedings.
Some people requiring personal assistance services rely on family members or friends for assistance. Others have services paid by themselves, the state or community programs. In either situation, if a person arrives at a shelter, there must be assistive services provided to those that need it. Good afternoon. I'm Debbie Costa, the Community Preparedness Officer for FEMA Region 2's Individual and Community Preparedness Program. We are focused on preparing individuals and communities for disasters by providing useful information and training, inspiring people to act and be ready for any emergency. On behalf of our team working to strengthen preparedness across New York, New Jersey, Puerto Rico, and the U.S. Virgin Islands, I'd like to welcome you to our webinar series. Today's webinar will discuss personal assistance services that keep people living in their communities and safe during congregate or non-congregate disaster sheltering. Our first speaker today is Everett Sedgwick. He is FEMA Individual Assistance First Disability Advisor working in the Mass Care Voluntary Agency Community Services Branch. He was with the Office of Disability Integration and Coordination for 7 years before joining Individual Assistance in 2019. Prior to joining the Office of Disability Integration and Coordination staff in 2011, he was with the FEMA Individual Assistance Mass Care and Emergency Services section, where he was the project manager for FEMA's 2010 Guidance on Planning for Integration of Functional Needs Support Services in General Population Shelters. Our second speaker today is Ms. Kimberly Grisham, and she has worked for FEMA Region 2 since November 2016, starting with the Public Assistance Hurricane Sandy New York Recovery Team. While in Public Assistance, Kimberly worked as a communications specialist, helping to clarify FEMA policy for our external partners. Kimberly currently supports the Individual Assistance Team as a voluntary agency liaison in Region 2, supporting New York State. Everett, I'd like to turn the mic over to you.
Well, thank you so much, but you're doing such a great job. Anyway.
No getting out of it.
Before I go into this, I noticed someone's name on here that reached out to me, Dr. Jacqueline McBride. Dr. McBride and I worked together in 2015 in South Carolina on a major disaster that we just had just a fantastic opportunity to move some things forward and reach a lot of people. So I just wanted to give a shout out to her before I get started and just let her know how much I still appreciate that time of being able to work with her. If we can go to the next slide. Actually, let's not. Let's stay there. I'm sorry. Let me just say that a little over a year ago, FEMA Mass Care Assistance Branch met with the National Council on Disability, NCD, to discuss the impact of COVID-19 on people with disabilities during a disaster. Now, NCD offered to facilitate a roundtable discussion with a number of disability stakeholders to get their input. This roundtable group continued meeting for several months, and one of the most common areas of concern during these meetings was the impact on people who require caregivers to provide activities of daily living when they are forced to leave their homes during a disaster and seek shelter. If anyone on this call has ever stayed in a disaster shelter, you know that it isn't the most optimal setting. If you're a person requiring PAS and those services are not available, a whole new disaster has occurred. Next slide, please. Before we go any further, let's be sure that everyone on the call, and I'm pretty sure that you do, but just let's make sure that you're aware of what personal assistance services entail. So I don't usually do this, but I'm going to read from this slide just to make sure that everybody has the same understanding. And that's it. Personal assistance services, PAS, are a range of services provided by one or more persons designated to assist an individual with a disability to perform daily living activities or activities of daily living on or off the job that the individual would typically perform if the individual did not have a disability. Personal assistance services may be provided by home health agencies, independent contractors, centers for independent living, family members, or friends. And personal assistance services categories go from informal to formal services. Next slide, please. Some people requiring personal assistance services rely on family members or friends for assistance. Others have access or services paid by themselves, the state, or community programs. In either situation, if this assistance is not available upon arriving at a congregate or non-congregate shelter site, and services haven't been planned for by emergency management or shelter planners, the risk of being placed in a nursing facility is imminent. The next slide. State, local, tribal, territorial governments have the primary responsibility for planning for and ensuring the immediate availability of PAS in disaster shelters, whether they be congregate or non-congregate shelters. And if we can go into the next, our meetings with disability stakeholders during the National Council on Disabilities roundtable sessions presented FEMA with issues regarding the impact to people requiring personal assistance services when they are not available at the time of arrival at a congregate or non-congregate shelter, especially during a pandemic environment. The high risk for persons requiring PAS if these services aren't provided, and the consequences of the absence of these services are persons who normally maintain their independence, who live in our communities, would be sent to nursing homes and lose their hard-fought-for independence. Next slide. Now, that in itself would be reason enough to be sure that we have PAS immediately available. But even a greater need when we know that there has been a disproportionate number of deaths from COVID-19 in nursing home facilities, institutionalization of people just seeking shelter is the most common answer for not preparing and having timely personal assistance services available. At the time, the U.S. Assistant Secretary for Health and Human Services, during a CNN State of the Union, stated that 50% of the total COVID-19 deaths were in nursing home facilities. Now, at that time, approximately 8% of all COVID-19 cases were found in nursing homes. That 8% bore the weight of 50% of the total COVID-19 U.S. deaths. Too often, in the wake of a disaster, persons seeking shelter who require personal assistance services are transferred to long-term care facilities because PAS is just not available. If personal assistance services are not planned for and provided on the onset of a disaster sheltering operation, lives of many will be at risk. We know that the occurrence rate is going down, and the number of deaths are receding, but the risks are still real. And so is the fear of institutionalization. And that's the case whether or not there's a pandemic going on or not. People who fight really hard not to have to be in an institutionalized setting, whenever there's a risk that that can change, is a real fear and something that we should all be concerned about. Let's read the last bullet on the slide. And that's the goal of emergency managers and disaster shelter planners must be to provide equitable services that ensures people living in their communities will be able to remain in the general population. The Stafford Act and the Post-Katrina Emergency Management Reform Act, PKEMRA, mandates integration and equal access for people with disabilities. Next slide, please. So what can FEMA do? Is FEMA a first responder? No. That obligation belongs to local governments, states, tribes, and territories. Does FEMA provide personal assistance services contracts? And that the answer is that FEMA no longer has a PAS contract except through our individual assistance support contract, which is just that, it's a support. If it's relied on to meet the immediate needs of people requiring personal assistance services, then we've already lost them. Personal assistance services are extremely important in maintaining the independence of people with disabilities requiring the support of a caregiver that provides activities of daily living. Daily, as in not 2 days or 3 weeks later. But by the time a state, tribal, territorial government recognizes it doesn't have the needed resources and request federal support via our support contract, daily can become 3 weeks. People requiring personal assistance services can't wait 3 weeks to have daily needs addressed or met. In addition to the individual assistance support contract, FEMA also provides technical assistance and guidance, such as PAS Addendum, which provides guidance, legal responsibility, and promising practices for emergency managers and shelter planners who are the initial responders. The document is both an addendum to the recently released Mass Care Emergency Assistance Pandemic Planning Guide, but it's also sent out separately so that it can be utilized immediately in planning and providing personal assistance services. Like any federal document, it had to be vetted. It has been approved by all the necessary internal and external offices and agencies, and has been forwarded to the regions, states, tribes, and territories, providing language that ensures that is understood that we have a legal and ethical obligation to protect all disaster survivors. I believe the addendum was included in the invitation to this webinar. If not, we'll be sure that it's made available to you, because it's worth both you having and you sharing to make sure that the information in it is being understood and utilized within your communities. Before we go to the next slide, I'd like to kind of personalize for people that don't really understand the importance of personal assistance services and what it means to people. And so I'm going to go back quite a ways, back to the aftermath of Katrina, where a woman was evacuated to the Astrodome, which was a mega shelter. She was an independent businesswoman who worked hard to be successful and own her own home. What I didn't mention was that she was paralyzed and required assistance that wasn't available to her when she was evacuated to the shelter. There she sat in her chair for 3 days, and with no one to provide assistance, she sat in her own waste, emotionally and physically devastated until pressure point sores had developed and became infected. When assistance was finally provided, it was to have her hospitalized in serious condition. From the hospital, she was sent to recover in a nursing home, where she stayed for 3 years. In 3 years, she lost her business, She lost her home. She lost her independence. After 3 years, even the chance to register for disaster assistance was lost. This is just one example of what can happen if personal assistance services aren't available at the onset of shelter operation and the devastating effect on a person's life. Many of you may remember that has been involved with FEMA and the disability world for a while. You may remember Richard DeVelder. Richard and I first met when he was the senior disability advisor for Governor Schwarzenegger. He later became a senior accessibility advisor to the Department of Transportation, and he also helped FEMA develop the Functional Needs Support Services guidance. And above all that, Richard was a friend and a mentor. I learned so much from Richard. But Richard was born without arms and legs. He was abandoned by his parents at birth and adopted by a family in California where he was raised to live and to be independent. And he learned to swim at 9 months old and continued through his 40-something years, which was too short of a life. And even though Richard required the assistance of a caregiver or personal assistance service provider, he developed ways of doing many things without assistance. He had an electric razor mounted to a dresser so he could shave himself. He used mass transit to go to and from work or wherever. And with a pencil in his mouth, he used a computer keyboard to work, develop guidance, prepare reports, or whatever. There are so many other things I could share about Richard and his success at being independent, but like the woman in the Astrodome, if he was evacuated to a disaster shelter and PAS was not available, with all the many things that he could do and the independence that he fought for so hard, he wouldn't have been able to maintain it. Richard would have been sent to a nursing home or facility and would have lost his independence. In a couple of engagement sessions that we had on personal assistance services, the National Council on Disability facilitator that I spoke of earlier provided her personal story. And it means so much more whenever she was providing it herself. But since she's not here, I'll just say that she stated that the same situation for the woman in the Astrodome would have been her nightmare. That even though she's a successful attorney for NCD, if she was taken to a shelter that didn't have personal assistance services available, she would be among those that would lose her independence. So we do a lot of planning, use a lot of statistics, and I understand the need for it, but we must always remember that our decisions and planning efforts affect the lives of real people who depend on us, emergency managers, shelter planners, disability stakeholders, to provide equitable and fair services across the board. If we can go to the next slide, please. So in short, what is the state, local, territorial, tribal role in the planning for the provision of PAS? Prepare for continuity in service provision prior to a disaster to avoid unnecessary or unjustified institutionalization of people with disabilities. What are the obligations under the Olmstead Act? I'm going to read this from the slide. The last bullet. It ruled that the integration mandate of Title II of the Americans with Disabilities Act requires public agencies to provide services in the most integrated setting appropriate to the needs of qualified individuals with disabilities. And people with disabilities have a qualified right to receive state-funded support and services in the community rather than in institutions. Next slide, please. Personal assistance services are provided in every community. But if you're a shelter planner or emergency manager and you don't know where to find these services, there are community-based organizations providing are advising on PAS, and some of them may be in this engagement session. Groups such as Centers for Independent Living, home health agencies, respite providers, mental health organizations, disability organizations, developmental disability organizations, agencies on aging, advocacy groups, protection and advocacy agencies, medical or vocational service agencies. They're in all of our communities. The people that have the information and have a way of pointing us in the right direction. Also faith-based organizations, local houses of worship, voluntary agencies such as American Red Cross chapters. But let's not forget the regional disability integration specialist and their wide reach to state and local disability stakeholders. All of these are areas that we can reach to as emergency managers or shelter planners to find out who it is in our communities that we need to contact to make sure that planning and contracts, if necessary, are put in place to support people with disabilities that require the use of personal assistance services whenever they're sheltering in either congregate or non-congregate shelters. I'm going to give you an example of how this can work based on something that really took place, and that's due to the major flooding in Baton Rouge in 2016. There are people requiring personal assistance services who were evacuated from their homes and went to emergency shelters. And at that time, there were a number of large shelters that were opened up because of the amount of people that were affected. Because of that early planning and having an agreement already in place, the New Horizons Independent Living Center, the Center for Independent Living out of northern Louisiana, provided personal assistance services with the shelters. They had connected with the Louisiana Department of Children and Family Services, and they provide the required personal assistance services and fulfill the obligations under the law. Services were conducted seamlessly. I know because I was involved in that disaster, and so I would view the different shelters that were opened and the services that were provided. But they provided personal assistance services through contractors, and they had the proper identification badges that were already in place. And they checked into the shelters where the survivors, the clients, were already staying or actually were being registered. There were no issues reported, and services continued until the clients were able to return to their homes or to suitable housing, which eliminated the need for transferring to nursing home facilities. By failing to secure these important services, we're placing disaster survivors in harm's way. Planning for and providing personal assistance services in congregate and non-congregate shelters is our collective responsibility. Please read the attached addendum, providing guidance on establishing PAS in advance of the next disaster. And then the disability stakeholders on this call, if you would, help by positioning yourself to guide and assist emergency managers and shelter planners in your communities and states to achieve the capability to provide this important service. I want to thank you for your attention and understanding of the importance of planning and providing personal assistance services. Now, either Deborah or Kimberly, I'm not sure who I should be turning this over to, but I'm stepping back and giving you the phone.
Thank you so much. And we are going to hold all the questions to the conclusion of both presentations. So Kimberly, if you want to go ahead, and then we'll take the questions at the end.
Hi, good afternoon, everyone. I wanted to first reiterate one of Everett's points in that state, local, tribal, and territorial governments have the primary responsibility for enacting PAS, because FEMA public assistance will only kick in if there is a declared disaster. So if there is a declared disaster and public assistance is eligible, this will be FEMA's role in PAS. Where is public assistance policy related to PAS found? Your primary guide for FEMA public assistance will be the Public Assistance Program and Policy Guide, affectionately known as the PAPA-G. The latest version was released last year, June 1st, and combines majority of public assistance policies into a single guide and provides an overview of all public assistance program implementation processes. The PAPA-G will also include information regarding eligibility for private nonprofit organizations. How can public assistance support personal assistance services? FEMA public assistance policy facilitates reimbursement to the state, local, tribal, territorial jurisdictions for the provision of emergency protective measures. You may also know emergency protective measures as Category B. This is managed through our regular public assistance grants process, working with the state, local, tribal, territorial governments as the authority rests with them to provide these services. Funding for personal assistance services is described in the FEMA Public Assistance Policy as emergency work, or like I said, Category B, and specifically emergency protective measures. State, local, tribal, territorial jurisdictions may implement measures to ensure sheltering, both for congregate and non-congregate, and they are provided facilities accessible for people with disabilities and to meet the needs of those same people while in a shelter. Some of these measures might include eligible costs related to sheltering, including minor facility modifications if necessary to make the facility habitable and compliant with the Americans with Disabilities Act. It can also include providing funding that supports a state, local, tribal, territorial jurisdiction to enter agreements or contract shelter staff, such as personal assistance service workers, which could include certified nursing assistants, prior to disasters that can be readily available to deploy to provide personal care to individuals with disabilities in shelters. There are some differences between public assistance for state, local, tribal, territorial jurisdictions and private nonprofits. Emergency services are the responsibility of those state, local, tribal, territorial governments. Therefore, private nonprofits are generally not the legal responsibility for those services, and FEMA does not provide public assistance funding to private nonprofits for the costs associated with providing those services. We see this a lot in disasters, that private nonprofits will offer the same or similar services for such as sheltering and feeding. It is important to remember that the responsibility for those services rests with the legal, with the state, local, and tribal territorial, who is the legal entity to provide those services. If a private nonprofit does provide those services and want to seek reimbursement, they would need to have agreements or contracts previously in place with the state, local, tribal, territorial jurisdictions in order to be compensated for any costs associated with PAS. If they do have those agreements and contracts in place and provide emergency services at the request of the legally responsible entity, FEMA can provide public assistance funding through the government entity. This means that the PNP would not apply as its own applicant, but would be reimbursed through the state, local, tribal, territorial entity as the applicant.
So what are the work criteria? Eligible, sorry, please excuse me. At a minimum, the work must meet each of the following 3 general criteria to be eligible. It must be required as a result of the declared incident. As I mentioned at the beginning, a federal disaster declaration is not always declared. If it is not declared, FEMA public assistance funding is not eligible. The work also must be located within the designated area. It's important to note that for sheltering activities, the sheltering must be used for a designated area, but does not have to be located in that designated area. Lastly, it must be the legal responsibility of an eligible applicant. An eligible applicant would be the state, local, tribal, territorial jurisdictions, or an eligible private nonprofit. For private nonprofits, as we mentioned before, if you want to pursue the opportunity to be a PAS provider or have their facilities considered eligible for public assistance during declared incidents, you should contact the State Emergency Management Agency to obtain information about PAS service provision or attend an applicant briefing. These briefings are run by the state to provide information about the application process and potential assistance. Applicants for FEMA public assistance must submit a request for public assistance through their relevant jurisdiction. For private nonprofits, there will also be an additional questionnaire to provide information on the services they provide. If you're a private nonprofit interested in becoming a PAS provider or a public assistance eligible facility, you should first refer to your state public assistance officer. That will be your first stop. If the state public assistance officer is unable to assist, you can reach out to the relevant FEMA region Recovery Division Public Assistance Branch. If you are a private nonprofit, you may also be able to reach out to your region's voluntary agency liaisons who can help connect you with the relevant contact. Other critical considerations. Both should explore other federal agency funding to support people with disabilities while residing in a shelter environment. Documentation is key, and please be diligent. For public assistance, any entity providing services under agreement or contract should maintain all their documentation of activities and costs incurred. Work with the state, local, tribal, territorial jurisdictions to plan for implementation of PAS with local resources. That should be the first priority. Before we get to the federal level, see how you can work on these issues at a local level. If you care to learn more about public assistance, there are several resources available online. One that is highly recommended is our Emergency Management Institute, which has a series of independent study courses on the different public assistance programs and eligibility. And that's the end of this part.
What did you say? This is the good part?
End of this part.
Oh, okay. Very good. Folks, if you haven't already put some questions in the chat box, we do have a few. Please add them to the Q&A box at the bottom of the screen. So question for what support FEMA can provide at the shelters. Will FEMA provide the accessibilities for deaf, hard of hearing, and deaf blind?
This is Everett, and FEMA is not the first responder that's on the ground. We support, we give guidance, but these things fall in the responsibility area of the local, state, and tribal territorial governments. And so FEMA supports things. We support them sometimes by funding. We support them sometimes by the guidance, and for the other things that we, and by also having regulations and stipulations on our funding to make sure that anybody that's doing something that is for FEMA, that's being paid for by FEMA, that they fall within the law when it comes to civil rights requirements. And so those things, they won't be done by a FEMA person, but what we're doing is providing information on what would be required to be able to cover what the needs are. Does that make sense, what I'm telling you?
It does to me, and hopefully it does to the person who asked that. Mm-hmm. So, Anne Marie, if that wasn't clear, then please type in the chat.
Well, let me just mention this, though, that there is some work being done at this point with our external affairs communications access people, with some of the regional disability integration specialists, and with our IA mass care office to provide some guidance on accessible communications in disaster sheltering. And we're looking at broadening it. The last time that information was really provided was back in the Functional Needs Support Services guidance of 2010. So much has changed since that time. And so things having to do with providing greater technology and the availability of it, and providing that to the stakeholders, to our emergency management people and our shelter planners, to make sure that they're aware of not relying on TTY to provide something that is greater than that, because TTY is no different than asking somebody to go to a phone booth or use a rotary phone in order to be able to communicate. They don't have it anymore. And so we're getting that document together, the guidance, and we're hoping to have that out within the next couple of months that can help assist in that area.
Okay. We'll look forward to it. Does activation of these services require a federal declaration?
From FEMA, yes. But
yes,
as far as responsibility, I'm sorry, go ahead.
I was probably going to say the same thing as you, Everett, that for FEMA public assistance funding, yes, there will need to be a disaster declaration.
Thank you.
And thank you, Kimberly, because the right person was supposed to answer that. Thank you.
Is FEMA PAS embraced, endorsed, rolled into what the American Red Cross does with shelter management?
Red Cross, just a couple of years ago, hired a disability coordinator, Sherry Myers, and they have a longtime staff member, Mary Casey Lockyer, who both were in Louisiana during the time of the mega sheltering and that contract. They're aware and have really supported that. Does every chapter embrace it? Because, see, it really breaks down again to local. I can't say to whether or not all the chapters throughout the U.S. and the territories, whether or not they embrace this requirement, but I know their headquarters is aware of it.
Okay. So not sure if this person misunderstood, but are they correct that there is no longer a FEMA contract to obtain PAS services? Therefore, we only have the PAS addendum as guidance. Is that correct?
Yes and no. The PAS contract that we had was just like any other contract. It had to be requested by the state, and then whatever time it would take which could be up to 3 weeks, maybe sometimes more, to be able to get subcontractors and others on the ground, it made it so that it wasn't practical to have a PAS contract that people that require daily activities of living and not to have them in place until 3 weeks later has no purpose. Now it is, and the two vendors that handle our IA support contract, individual assistance support contract, that covers all of the U.S. They are aware of their obligation to provide PAS if they open up shelter operations, but again, it would be in support. And so the usefulness of it is if you already have opened up a shelter and you already have PAS there, but the time is getting to the place where you're having trouble keeping the support people that you have, then they can, if the state approves it, then they can have people via the IASC to be able to come and support that area. But then again, that's also, and Kimberly, correct me if I'm wrong, but that's a shared cost on that. And what you'll find is things that you apply for, things that you contract and put in place locally is a lot less expensive than even the portion that you would spend on a federal contract.
Thank you, Everett. The person who asked the question said that explanation was very helpful. Appreciate it. Mm-hmm. I believe that's all the questions we have for today. If Kimberly or Everett have anything else that they want to add before we go into our closing? Okay.
Well, this is Everett. Let me just say how much I appreciate the interest that you asked for this topic to be brought up with your group of partners that I understand is pretty large. And so thank you so much for allowing us the opportunity to share this. And if there are further questions or other thoughts that come up, then you have our contact information, and please reach out to us.
Okay, very good. Then Allison is going to put up a very short 3-question poll on the screen. If everybody wouldn't mind taking the 30 seconds to fill it out, it does help us to drive future programming. Really, I have to, we can't take the credit for building the content on this webinar. That goes to our Disability Integration Advisor and his team for the region. Jim, thank you very much, and Kathleen and Rachel. We do have lots of excellent webinars still coming up. We will have one on the dam safety program and technical assistance with our friends from mitigation. This month is Older Americans Month, so we will have a webinar on preventing scams that specifically target our older Americans. We do have a monthly webinar with mitigation on their guides to expanding mitigation into different areas. Everyone loves pets, their pets, and what do we do with them in an emergency, and the Red Cross is going to join us and talk about some pet safety for fires and other hazards, and very brief introduction of first aid. And then with New Jersey's Office of Homeland Security and Preparedness, we will be working together on a virtual House of Worship security program where OHS&P will talk about the grants available for houses of worship. DHS talks about their programs, and CISA, FEMA will let houses of worship know what kind of services are available from FEMA, how we can help support them. So it's a really good program if you have an opportunity to join us. If you know somebody who would benefit from listening to today's webinar and they weren't able to join us, it has been recorded, and it will be uploaded to the FEMA.gov and the FEMA R2 website. If you check back in a couple of weeks, that second link on your screen that says recordings will take you there. The first one is a calendar of all our upcoming webinars. And if you don't already get news from Region 2 and you'd like to, just click that last link there. Of course, if you have any comments about today's webinar or suggestions for a future topic, don't be shy. Feel free to email us at FEMA-R2-prepares. Everett, Kimberly, thank you both so much. The content is very much appreciated. And thank you to all our participants for joining us today. It's a beautiful day. I'm giving you back 15 minutes for your day. Go take a walk around the block. Have a great day.